Hey everyone, this is Eric and welcome back to another anatomy video. And today we're going to be going over anatomic planes. Now there are three main type of anatomical planes, and the first we're going to go over is going to be called sagittal planes. Now sagittal planes cut down the human body in normal anatomical position, so hands along the thighs, thumbs extended, feet flat, hands and palms facing forward. That's normal anatomic position. The sagittal plane is going to cut down the long axis like this. Now there are an infinite amount of sagittal planes going through the body. And planes come in importance when identifying a location or even doing dissections. You'll see that some cadavers have a sagittal cut down the caput right here. Sometimes they have a transverse cut just right on the on the crown or towards the crown. So planes come into great importance. So the blue right here represents sagittal planes. Now, there's one type of sagittal plane that is of utmost importance, and it's going to be called the mid-sagittal plane. And the mid-sagittal plane is the exact center along the long axis of the human body. This right here, the red, is the mid-sagittal plane, and it's going to be a reference point of some different directional terms that we'll go over later. But let me write this down first. So the red is mid-sagittal plane. Another appropriate name for mid-sagittal plane is the median plane. So I'll write that down too. The second type of plane that we're going to be learning is going to be called the transverse plane. So transverse plane goes in perpendicular to the long axis. So the long axis, it means from top to bottom. So down this direction is the long axis of the human body. The transverse plane is going to go perpendicular to that. So it's going to go like this. These are transverse planes. Perpendicular to the long axis. Okay? And no, there isn't any secondary name like the mid-sagittal plane. These are all just transverse planes. Now the last plane that we learn in anatomy is called the frontal plane or the coronal plane. So let me write that down. Oh, I forgot to write transverse, sorry. So green is transverse plane. Now we're going over frontal or coronal plane. Now in the second image right here, the mannequin or the human body on the right side, I haven't touched yet. It's there for me to demonstrate what a frontal plane does. A frontal plane cuts right down the side like this. This is different from a sagittal plane because remember, sagittal planes cut down the long cut down the long axis from front to back like so. Coronal or frontal planes, they cut from left to right. And I hope that makes sense what I mean by left to right. Meaning, right here, it's going to cut, this frontal plane is going to cut the very tip of the nose, and it's going to make a nice sheet. The plane's like a sheet, right? And it cut just the very tip of it. So that's what I mean by left to right. And this is going to be frontal or coronal plane. Awesome. So those are the three different types of planes. Remember, the sagittal plane and the frontal plane, they go along the long axis. One goes from front to back, which is sagittal, and then the frontal plane goes from left to right, and that is the frontal or coronal plane. And then the one that goes perpendicular to the long axis is the transverse plane. And those are the anatomic planes. Now, there's some other things that we need to learn now that we have a foundation of planes. So like I said before, planes act as a reference point on occasion. And they are reference points for directional terms that we use in anatomy. There are 6 main anatomic directional terms. And those are the following. Starting with medial and lateral. So let me draw this mid-sagittal plane again. So this is the mid-sagittal plane. Now medial means we're going towards the mid-sagittal plane. For example, my abdomen is medial to the manus, right? My abdomen is closer to the mid-sagittal plane than the manus is. So that's medial. That's an example of how you can use medial. Medial means is just stating that something's closer to the mid-sagittal plane. Now lateral means it's going away from the mid-sagittal plane. So we can use that same example. My manus is lateral to my abdomen. My hand is further away from the mid-sagittal plane than my abdomen is. So that is the definition of lateral and medial. Medial means it's getting closer or towards the mid-sagittal plane, and lateral means it's going away from the mid-sagittal plane. So those are 2 of the 6 principal directional terms. Next one we have is superior and anterior. So we remember this region right here. This was the vertex or the crown. Now, if we are going closer towards the vertex, this is superior. And if we're going away from the vertex, that's going to be inferior. So that's the definition. The reference point for superior and inferior is the vertex. Superior going towards the vertex and inferior going away from the vertex. And now the last 2 directional terms are going to be anterior and posterior. Anterior means it's going closer to the front of the body. See this green arrow? It's going closer to the front. So if this is the front, it's going closer to that. Now posterior means it's going closer towards the back of the body. So an example of this. My facies is more anterior than my dorsum. Does that make sense? So my facies, which is this region right here, is anterior to my dorsum. Meaning my face is from closer to the front than it is to the back. So let me quickly write out those terms because I didn't write them out as I was explaining them. So remember we have medial and lateral, and their reference is the mid-sagittal plane. We have superior and inferior, and their reference point is the vertex. And the last pair was anterior and inferior. Posterior. Awesome. Not too hard, right? Medial and lateral, superior, inferior, anterior, and posterior. Those are the 6 principal directional terms in anatomy. Now we have a foundation of planes and the principal directional terms. We can actually learn additional directional terms that anatomists use that you'll hear throughout the course. Starting with proximal and distal. Proximal and distal means something that's further or closer in reference to something else. Now proximal and distal, they have a reference point as well. And their reference point is the attachment point of the limb. So proximal, let me write this out. Proximal and distal are only used for superior slash inferior limbs. Let me explain why. Right here are the attachment points of the superior limbs. And here are the attachment points of the inferior limbs. Proximal means something's closer to the attachment point. So the shoulder, or the regiodeltoideus, is the attachment point of the superior limb to the trunk, right? The superior limb attaches to the trunk in regiodeltoideus, or the shoulder. So anything that is closer to this attachment point is proximal. And the opposite goes the same way. Anything further away from that attachment point is going to be distal. An example: my antebrachium is distal to my brachium. Meaning my antebrachium is further away than my brachium is in reference to the attachment point of the superior limb. So when we're talking, you might be in the wet lab and you say, oh, where is this landmark? It's like, oh, it's a little bit more distal to this, meaning it's further away to the reference point of the shoulder or the hip. And we can use the same thing for inferior limb, like I mentioned. Distal and then proximal. My genu is proximal to my pes. Right? It's closer to the hip than it is my foot. Okay? Perfect. So those are two additional directional terms that are helpful and that you need to know. Other directional terms. You have superficial or external, and deep and internal. So superficial is the same thing as external. For example, my skin is more superficial than my heart, meaning the skin is more external, it's closer to the outer surface than my heart is. That's all superficial or external means. Something's closer to the body's surface. And then the same can be, but opposite, to deep. Or you can say internal. My heart is deeper or more internal than my skin. Makes pretty easy. It makes sense. It's not too complicated to understand that. The next one is dorsal. Now dorsal, let's see if we can zoom up on this. Not very well. That's okay. Dorsal means the back, right? We have dorsum. That's the region. Dorsum means back. Now the dorsal aspect, or the dorsal part, means the back of something. So right here on the top of your foot, this is going to be the dorsal aspect of your foot. Because it's the back of your foot. Versus the ventral part. Ventral means the belly or underneath. So the belly of your foot, or the underneath part of your foot, is going to be the ventral part. Okay? And those two aren't as commonly used, but you might see them on a quiz question or an exam. So keep an eye out for those. Palmar is very easy to understand. Palmar just means the palm aspect of the hand. So palmar is right here. And as I mentioned before, dorsal, the dorsal aspect of the foot, can also apply to the hand. So right here we have the palmar aspect of the hand, but on the back of the hand, it's going to be the dorsal aspect of the hand. So we have dorsal, and then we have palmar. Easy enough. Now, we had palmar, and that's for the hand, so we also have a special word for the bottom of your foot. I mentioned ventral, but you also have plantar. So plantar is the bottom aspect of your foot, and that's only for the foot. You can't use it for anything else. Palmar for palm, plantar, as some people pronounce it, is the bottom of your foot. Okay? Those are easy to remember. Next one we have to learn is tibial and fibular. So we have two bones, one right here, closer to the mid-sagittal plane. I'll drum on both legs. And then we have another one on the lateral aspect. You'll soon learn that these two bones are called the tibia and the fibula. So when someone says it's on the tibular aspect of the leg, that just means it's closer to the mid-sagittal plane. Okay? Same thing goes for the fibula. If they say it's on the fibular aspect of the leg, it's going to be on the more lateral aspect. So you could either say on the medial aspect of the leg, which would be the same as tibial, or you can say on the fibular aspect of the leg, which would mean the lateral aspect. Those are just some additional terms that you might hear. Same thing goes for the arm. You have the ulna right here, and then you have the radius right here. So someone might say, the thumb is on the radial aspect of the superior limb. What they're saying is the thumb, right here, is on the radial aspect, meaning it's on the same side as the radius on the superior limb. And then same applies to the ulna. It just means it's on the more medial aspect of the superior limb. Cool. And we already talked about longitudinal. Longitudinal just means along the long axis. So here's the longitudinal portion of the body, longitudinal aspect of the superior limb. Same thing with the inferior limbs. Some bones are oriented, their long axis, they're longitudinally oriented this way. You got clavicles, the long axis is going perpendicular to the mid-sagittal plane or the long axis of the superior limbs. So longitudinal just means along the long axis, and transverse means perpendicular to the long axis. Okay? Now, there's the last two terms that I'm going to go over are going to be contralateral and ipsilateral. And they're kind of hard to write, so I'm going to write them down. Ipsilateral is one, and then contralateral. Good. Ipsilateral means something is on the same side. Okay? So for example, you have your heart right here on the left side. Okay? You also have your spleen on the left side. So you can say the heart is on the ipsilateral side as the spleen, meaning the heart is on the same side as the spleen is. Okay? You could also say, let's see, my vermiform appendix, which is right around here, my appendix is on the contralateral side of my heart, meaning it's on the opposite side of the mid-sagittal plane. Okay? So ipsilateral means same, and contralateral means opposite. That's it. That's all you really need to know as far as directional terms and the planes go. I guess there's one last thing I want to mention that they sometimes bring up is left and right in Latin. Right in Latin, I need to spell right correctly. Right in Latin is dexter, and left in Latin is sinister. So your sinister manus would be this one right here. Your dexter pes would be this one right here. Okay? So in order to get really good at these, you just got to practice with one of your peers, your study mates. you just gotta practice using these directional terms, and soon these terms will become second nature. I mean, you'll be saying things like my cubitus is superior to my manus, my mentum is inferior to my nasus, the heart is on the ipsilateral side of my left hand. So just practice these terms and they'll become much easier than they appear to be right now. So yeah, study hard and good luck, you guys. See you next time.